Pride Month and beyond the celebrations and colors, people in the LGBTQ+ community experience healthcare disparities and barriers. And it is important to acknowledge the significance of inclusive healthcare for everyone. So joining me right now in Studio 61 is Dr. Tyler Traster, Assistant Professor of the Nursing Program at the Quinnipiac University School of Nursing. Dr. Traster, thanks so much for being with us.
Yeah, thank you so much for having me. Good morning.
Thank you. Yeah, this is such an important issue. Talk about the health barriers and inequalities in LGBTQ community.
Yeah, for sure. So the LGBTQ community can be defined, lesbian, gay, bisexual, transgender, and now queer community. It's a very rapidly growing community. We see Gen Z about now upwards of like 20% of Gen Z folks are identifying within this population. We've seen great progress politically, across the United States. When we look at that, however, there's still some barriers that are still here. We see higher rates of like substance abuse, cardiovascular disease, less access to cancer screenings, and that can all be equated to kind of like barriers to care. So looking at how do I get into care, who's a safe provider for me to see, kind of all depends on where you're at and how do you access that.
And we talk about healthcare for everyone. It's really critical to include mental health care.
Yeah, absolutely. And we see higher rates of that mental health with them, and it really starts in that young trajectory with those folks, bullying in high school, and
right.
That can last throughout a lifetime.
Yeah, so how can we break this stigma?
Yeah, so there's many ways we can break it. I know here at Quinnipiac University what we're doing is really looking to train the healthcare providers of the future. So we're integrating clinical experiences where they get to meet real live LGBTQ+ people, care for them in the classroom and in the clinical setting. And then just, as I said, if upward of 20% of people, that means that your friends, families, coworkers are all identifying as probably LGBTQ. So engaging with those individuals, and for us as healthcare providers, it's really taking that next step to make sure that we can care for them.
Let's talk about our seniors in the LGBTQ community. What do they specifically need to be aware of and really reach out for?
Yeah, so those seniors, we see that some of them will actually go back in the closet, if you will, whenever they're going to a long-term nursing care facility, because they fear that maybe their nursing care or physicians, whomever, may judge them differently. But it's finding those providers in the area. I think here in Connecticut, we're very fortunate. We have like Anchor Health, which is a great area there. Local provider of health, we have Hartford Healthcare, and even Yale New Haven have great resources for older adults to really make sure that we're doing those cardiovascular and cancer screenings for them.
Talk about breaking down the stigma. What's being done? What kind of progress are we seeing, and what still needs to be done?
Yeah, so that progress, like I said, we're integrating that into our curriculum. If you look 10 years ago in medical and nursing curriculums, we weren't teaching about LGBTQ+ health. And now we're giving the students that education that they need to. Here in this home state of Connecticut, we have great policies and stuff that are working to really move us forward in that area. Hartford Healthcare, Yale New Haven, we're getting out into the communities and building those partners. We're meeting those people where they are on their own ground.
Anything else that you want to speak on regarding the subject, and as far as looking ahead?
Yeah, so looking ahead, I think we have a bright future ahead of us. I think there's a lot of progress to be made, and hopefully as we look towards the future, we'll see these health disparities decrease as we see the population become more accepted and people feel more welcome within healthcare.
All right, well, that is so critical. Doctor, thanks so much for being with us.
Thank you so much. I really appreciate it.
We do appreciate your time
and
for speaking to us and our viewers.
Great.